like?
So you're raising a very interesting issue about a phenomenon they're seeing now where women are having babies who are, they don't say they're addicted because addiction involves a behavioral
You're
component.
right.
So
Right.
the babies are born dependent on the drugs their mothers are taking. Now the interesting thing is that many times these mothers are on maintenance therapy for an addiction that they're fighting or that they already have under control. And you're not supposed, if you're on methadone or Suboxone, you're not supposed to stop it.
These
when
are
you're pregnant.
these are the heroin blockers, generally.
Right, right. They exactly.
Opioid blockers?
They reduce your cravings for the drug. So they work for opioids, and if the opioids are your main concern, then this can help you manage your life and live a normal life.
Right.
And so there are women who become pregnant, or they were active users and they become pregnant and they need to get it under control. And the way to do that is with drugs. But this takes it into the next generation so that then the babies are born dependent on the drugs and have to be.
How do you wean the babies? I mean, you can't tell them not to do something. They do.
Right,
and
right.
they're going to suffer
So
withdrawal.
Yes. So wait, this is actually a very complex topic, and I wanted to get back to your question about, there's been nationwide a 5-fold increase in babies born with what they call neonatal abstinence syndrome. So this big increase in babies born dependent on drugs. Many of them have to stay in the hospital, and that somebody recently did an estimate that's $1.5 billion a year, 80% of that on Medicaid. So yes, it's affecting Medicaid.
Wow.
But the key thing is, it's not necessarily a tragedy. A good percentage, 20 to 40% of the babies whose mothers were taking these drugs are not affected by it. They go home, they're fine.
Fantastic.
The ones that are there, they have to be, the fact is the doctors don't really know the best way to treat them, and they're now studying it, even though this phenomenon has been around since the 70s. They're finally looking at it closely and trying to figure it out. But what they do is they give them a little bit of morphine, I think is one common drug, or I don't remember what the other one is, but they give them tiny bits of drug and gradually wean them off it. And no one really knows how the babies do long term. Some of them may have problems with jitteriness and anxiety and that kind of thing, or some developmental delays, but no one really knows. And the general feeling is that the environment is the most important thing. So if the mothers will stay with them and comfort them and cuddle them and give them breast milk, and then if they go home to a good supportive environment and they have the services they need and they have
that
early
can
intervention,
overcome what
they will do as well as any other child. I mean,
that's a very
that's
uplifting note.
That seems to be, that's been the experience with the crack babies, the so-called crack babies, when that was a big issue. That children are not just like chemicals, their environment and the love and the attention they get is what's going to make a difference in how they do.